April 2025, Social Security checks are about to go out. Up to $5,108 in payments are going to specific individuals. I am going to give you details about that. And there is breaking news out of the Social Security Administration. There are sweeping changes that they're making that are going to go into effect starting April the 14th. And you need to be ready for that. Now, you may have not received a letter in the mail explaining these changes to you, and if you haven't, it is because they did not mail letters to recipients about these changes, but they're going to go ahead with them anyway. So my job is to bring you details about these changes that are going to happen starting April the 14th, how they're going to affect how you interact with the Social Security Agency regarding your benefits. This is information you cannot miss, so stay tuned. And then watch till the end of this video because I have information about Medicare. If you're turning 65 and you are trying to apply for Medicare, or you are already on Medicare but need to get to a better plan that suits your needs and your budget, I have great information for you at the end of this video. So I am Kwame Kwade. I am an entrepreneur and personal finance expert. For 15 years, I've been creating content to help seniors get the retirement benefits they deserve. We have websites that we've built on Social Security, Medicare, Medicaid, food stamps, and now we are creating video content to bring you more breaking news information. And I am also an adjunct professor. I teach entrepreneurial finance to graduate students at one of the most prestigious universities in the United States. Now, if you're new here, hit the like button, hit the subscribe button because we appreciate your support. And finally, as always, we want to know where you're watching this broadcast from. So go into the comments and let me know your city and your state. So let's dive in. What is the Social Security payment schedule and who is getting the most benefits? In January 2025, that is $5,108. That is the maximum amount that you can get if you've paid the maximum into the Social Security system. And it is for those people who are retiring and waited until age 70 to collect their maximum benefit. Now, if you are retiring this year at your full retirement age and you paid the maximum into the system, your maximum benefit is $4,018. And if you are retiring early at age 62 and you've paid the maximum into Social Security, you are going to get $2,710. And the average benefit for all Social Security recipients is $1,925 as of November the 2024. Now, there's a big change that is happening this year. The full retirement age is going up again by 2 months. It's going to 66 years and 10 months for people that were born in 1959. If you were born in 1960 and onwards, your full retirement age is going to be 67, and that's going to be permanent. And there's actually talk of actually increasing the full retirement age again to 69, and that is going on in Congress. That's a whole different video I will have to bring to you later. But let's talk about Social Security payments. You may not know this, or you may know it already, but your payments are based on your birth date. So if you're on Social Security retirement benefits or SSDI, Social Security Disability Insurance, your payments are based on your birth date. So if your birthday is between the 1st and the 10th, you are going to get your benefits on the second Wednesday of the month. If your birthday is between the 11th and the 20th, is the third Wednesday. And if your birthday is between the 21st and the end of the month, your payments hit on the fourth Wednesday of the month. Now, for SSI, Supplemental Security Income beneficiaries, you get your payments on the first of the month. And then there's a whole category of people that get their payments on the third. Those who live outside the United States, if you receive both Social Security and SSI benefits, if your state pays for your Medicare premium, and if you file for Social Security before 1997. So here's how the actual dates break down. April the 9th is going to be for those people whose birthday is between the 1st and the 10th. April the 16th for those between the 11th and the 20th. And then April the 23rd for those between the 21st and the 31st. Now, if you're on SSI benefits, you should have received your payment on Tuesday, April the 1st. If you didn't receive your benefits, stay tuned. I'll tell you what to do about that. And on Thursday, April the 3rd, the following category of people should have received their benefits already. If you live outside the US, if you receive SSI and Social Security, if your state pays for your Medicare premiums, and if you file for Social Security before 1997. Now, if you did not get your benefits, which is becoming very common these days because of a new rule that I'm about to talk about, a new change they are making that started on March the 27th. If you have an overpayment situation, they're going to hold your Social Security benefits and not send it to you, and use that money to pay your overpayment until it's all paid off. I'll explain that in details shortly. So if you don't get your benefits, the best thing to do is call the Social Security Administration and find out. Now, there are long wait times, so you have to be patient, but call them at 1-800-772-1213. Now, what are these rules that I'm talking about? This is a very, very weird thing they're doing where usually when the Social Security Administration makes a new rule this big, they send you a letter explaining everything to you, how it affects your benefits. But with everything Doge is doing, they are making so many changes so rapidly, they don't have time to mail letters. And so you're not going to get a letter anytime soon, but the changes are happening. I want to explain them to you. So this rule has to do with identification and verification. So major Social Security policy changes are here. How do they affect you? These changes are critical for all beneficiaries to understand, ensuring they don't face unexpected disruptions. The new in-person identity verification rule will now take effect on April the 14th instead of March the 31st. That was the original date they were going to implement it. They got some pushback, they backed off, they gave it 2 more weeks, but it's happening. This delay offers additional time for seniors and other affected individuals to prepare for the new requirements and understand how they might be impacted. Who is exempt from these new rules? Well, if you're applying for Medicare, if you're on disability and SSI, applicants are exempt from in-person verification if they cannot complete the process online. These exemptions aim to protect vulnerable populations who may face significant barriers in in-person verification. Why do these changes matter? Why should you care? Well, these changes aim to reduce fraud, but could create challenges for seniors and vulnerable population. Understanding the impact of these changes is critical to ensure you continue to receive the benefits you are entitled to without interruption. So what are all these changes that are happening? Well, the first one is the most important, is the in-person verification. Retirement and survival benefits applicants must verify their identity in person at a Social Security office if unable to do so online. That is a big change because 40% of all Social Security applications are done over the phone. This requirement aims to reduce fraudulent claims, but will also pose a burden on those without internet access or those who have difficulty traveling. And then there's the overpayment rule, which is also very significant. Starting March the 27th, SSA would withhold 100% of benefits to recover overpayments for new cases. This change in policy significantly increases the financial impact on beneficiaries who have received overpayment letters requiring immediate and full repayment. You already know about COLA changes that happened earlier this year. The next big change is staff reduction. The Social Security Administration is cutting staff at a rapid rate at a time when they need more workers to service the ever-growing number of retirees that have hit an all-time high. So retirement beneficiaries are at an all-time high, and they are cutting staff at the same time, creating problems with services availability and wait times to get services. So who is affected by these changes? Well, if you are applying for retirement benefits, those applying for retirement benefits or auxiliary benefits must verify their identity in person if online options fail. The new rule adds a layer of complexity, especially for those unfamiliar with online processes or who lack reliable internet access. And then if you were overpaid in benefits, if you got benefits you did not deserve, then you owe money. Now, starting March the 27th, instead of withholding 10%, they are going to take entire paychecks, entire Social Security checks, and Use it to pay what you owe until it's all paid off. And then low income seniors. If you are receiving SSI benefits, redetermination are going to get more aggressive. These audits will lead to benefit adjustment or terminations if income or asset criteria are not met. So expect them to scrutinize supplemental security income applicants or beneficiaries even more. And then those without online access are going to struggle, because if you cannot verify your identity online to access certain services, then you have to go into the Social Security office. Now, who is not affected by these new changes? Well, Medicare, disability, and SSI applicants are exempted from the ID verification rules. This exemption is designed to ease the process for these vulnerable individuals undergoing complex application processes. And then there's current people who are on overpayment that already are at the 10% collection rate. So if you are currently in an overpayment payment plan where you owe money due to overpayment and you're already on a payment plan, then the 100% rule does not apply to you. Also, they're thinking about extending the in-person ID verification rule exemption to survivor benefits applicants, because if somebody's applying for survivor benefits, they're already going through a traumatic experience, and making the process even burdensome for them, it's a little unfortunate, and they are taking a look at that. Now, no action needed. Beneficiaries, if you're currently receiving Social Security benefits and there is no problem with your benefits and you don't need to make any change to your direct deposit or your address or any other information, then you do not have to comply with this new ID verification rules. So I want to make that clear. If you're currently on benefits and everything is good, then you do not have to make any changes or be impacted by these new rules. Now, if you're currently on benefits, when do you have to go to the Social Security Administration office? Well, if you want to make direct deposit changes, starting April the 14th, current beneficiaries who cannot use their online My Social Security account to change direct deposit information must visit an office in person. And then existing recipients who need to verify their identity for whatever reason and cannot do so online have to go into the office. Now, if you want to avoid having to go to the Social Security office and you're currently receiving benefits or trying to apply for benefits between now and April the 14th, here's what you can do. Number one, set up an online account on socialsecurity.gov so that you can access your benefits and verify your identity in the current process before the new process kicks off. And then verify your online identity through login.gov or id.me, two processes that you can do right now, and get through all of that before the new rules start kicking in on April the 14th. Update any information that needs to be updated online, your address, your phone number. Make sure that all your information with the Social Security is up to date, because it smooths the path for you when you try to apply for services online or make changes online if you know how to verify your identity online. Now, you can choose to receive available notices online instead of by mail through your Social Security account, reducing paper correspondence and potential office visits. Now, what actions should you take before April the 14th? Obviously, create an account online if you haven't already and verify your identity. Update your direct deposit information if you need to before April the 14th so that the new rules do not apply to you. And then if you have to schedule an in-person visit, do it now, because the phones are going to be off the hook. They're going to get so many calls after April the 14th because people are going to wake up and realize that things that they could do online previously, they cannot do online or even over the phone. And so now everything is going to be backed up. You want to avoid that. So schedule an in-person visit now by calling the Social Security Administration at 1-800-772-1213. And then if you hit a jam, if you are frustrated, you're being treated unfairly, your case is dragging on, you can reach out to your elected representative. Your senator, your congressperson can help you at least get some face time with the Social Security Administration, because when they receive letters from Congress people or senators, they take it seriously. And so that could be another help opportunity for you if you are frustrated with your particular case. Overpayments, let's talk a lot more about that. Previously, the rule was 10%. If you get an overpayment situation, they'll only take 10% of your Social Security check until you've paid back the money. Now it's going to be 100%, and it's going to impact seniors disproportionately because 40% of seniors rely on Social Security as their only source of income. So taking somebody's entire Social Security check is going to be devastating, and it's only saving the government $7 billion. I mean, that's a drop in the bucket considering the deficit that they face with Social Security in 2033, when the trust fund is going to run out of money and they'll have to cut benefits by 21%. But if you get into an overpayment situation, you can also appeal. You can request for a waiver. A waiver means that you cannot pay the amount because it's going to cause you severe financial hardship, or an appeal because you think it's unfair and you want to challenge it. They rarely grant these appeals or waivers, but it's worth the try, especially if you get counsel, if you get an attorney that can help you get through this process. And then if you're on SSI or disability, just get ready. There's going to be more scrutiny. Disability beneficiaries are going to face a lot of scrutiny, both during the application process and while you're on benefits, because they are determined to knock a lot of people off disability because they perceive that a lot of people on disability do not qualify, or they are still not disabled or currently disabled and are claiming benefits. That is the assumptions they are making. And so expect more scrutiny. Get your documents ready. Make sure that when they send information to you, you respond timely, and that you stay on top of all the things that you have to do, including if you're working and on SSI or SSDI. Make sure that you are reporting your income and not going over the substantial gainful activity limits that could trigger an audit or a redetermination that could cause you to lose your benefits or get severely reduced. So the big takeaway is that they are implementing rules on April the 14th, and they haven't mailed anybody anything in the mail, but they're going to go ahead with it. If you are currently on benefits and everything is okay, you don't have to comply with these new rules. But if you're applying for benefits, or you need to make a change to your current benefits and you cannot verify your identity online, you have to go to the office in person to do that. That is going into effect April the 14th. And if you are on overpayments, now they're going to take 100% of your check if it's a new overpayment situation starting March the 27th. If you need help, contact the Social Security Administration or contact your elected official who can help you get FaceTime with the Social Security Administration, especially if your case is complex and you are struggling to get the attention of the Social Security Administration, or they're cutting your benefits and you don't know why, or you don't understand why. Contact your elected representative. Now, let's talk about Medicare. If you're turning 65, you know Medicare is in front of you. Or if you're currently on Medicare and you are frustrated because it doesn't cover your medications, it doesn't cover your doctor network, or your plan got dropped, or the costs are outrageous, well, let's talk about how you can save money. Well, it's all over the news these days that people are getting dropped. And, in certain states, it's worse than others. But the common thread is that a lot of seniors are facing Medicare disruptions. And I want to bring you some good news about that. Well, here's the fact. 24,000 Medicare plans are out there nationwide. And most of these plans are local. So you have to figure out whether your doctor is in your network, whether your medications are covered, and budget. And so with all these plans to go through, 90% of all seniors are in the wrong Medicare plan. That's a big fact. But how did that happen? It's because the whole system is so confusing. Picking the right plan is difficult and overwhelming, and picking the wrong plan will cost you. Will cost you money, will cost you your health, because you want the plan and access when you need it. And when the services are not there for you when you need it, that can be frustrating. And we have a solution. We have partnered with our friends at Chapter Medicare, and I'm going to walk you through the 3 reasons why Chapter is in my opinion, the best Medicare advisor out there, because of 3 advantages that they have over the others. Number one, they are the only Medicare advisory company that have access to all 24,000 Medicare plans. So they can see everything in your area and be able to locate and find you the best plan that fits your needs and your budget and the coverage that you need. Their services is free to you. They're unbiased because their agents do not work for commission. So they are not there on the phone with you trying to sell you the plan that will give them the best commission. Their sole mission is to help you find the best plan. And their story, how the company got founded, is even more interesting, because one of the co-founders got involved in this because of his parents' experience signing up for Medicare, and the fact that the negative experience they have made such an impact on him that he wanted to set up this company that can cut some of the red tape and cut some of the frustrations that seniors get, and get you the benefits that you rightly deserve and have paid into. So they can also save you a lot of money, $1,100 on average. And so if you're turning 65 or you're in a plan right now, there may be a small window for you to be able to change your plan. So act now and call Chapter at 539-205-2147. These guys are highly rated, A plus through the Better Business Bureau, a lot of 5-star reviews online, and they can help you save a ton of money. Now, if you're turning 65, what are some of the Medicare rules that you need to know? Well, you know that there's initial enrollment period that you need to take care of, and that is 7 months period that you have to sign up for Medicare. It starts 3 months before your 65th birthday, and it ends 3 months after your 65th birthday. And then there's automatic enrollment. If you're already receiving Social Security benefits and you are now turning 65, then you will be automatically enrolled into Medicare Part A and Part B. If you turn 65, no additional steps are needed unless you want to add a Part D or Medigap. If you're still working and you're 65, if you have employer-based health insurance, check with your benefits administrator to decide whether enrolling in Medicare makes sense for you, because larger employers often allow you to delay enrollment without penalties. And then finally, you can avoid late penalties. There are penalties if you don't enroll in Medicare at the right time. Enroll on time, even if you are not ready to retire. Delaying Medicare Part B and D can lead to lifelong premium penalties. If you are retiring and leaving your job, what are the rules you have to follow? Well, you have an 8-month special enrollment period after leaving your job or losing employer-based coverage to enroll in Medicare Part A and Part B without penalties. This ensures continuous coverage during your transition. And then there's prescription drugs. You must enroll in Part D within the first 2 months of your special enrollment period to avoid the Part D late penalty. And then there's COBRA. A lot of people have misconceptions about COBRA when it comes to Medicare. COBRA or retiree health plans do not count as creditable coverage for delaying Medicare enrollment. So sign up for Part A and Part B during your special enrollment period, and ask your employer for proof of creditable coverage if you're delaying enrolling in Medicare while working. This documentation can save you a lot of headaches later. What if you're moving out of state? Well, your original Medicare Part A and Part B coverage remains valid nationwide, so you don't have to do anything regarding that. But your Advantage plans, as I mentioned earlier, are location specific. So moving out of state requires enrolling in a new Advantage plan. So call Chapter Medicare and they can help you with that. Part D prescription plans. If you're enrolled in a standalone Part D plan and you're moving, you may need to switch plans based on your new state's offerings. Use the special enrollment period, which is triggered by your move, to avoid penalties of gap in coverage. And then if you're moving, update your address, especially given everything that's about to happen on April the 14th. Make sure you update your address with the Social Security Administration while you're moving. So, Chapter can help you through all your Medicare needs. If you're not sure what they can do for you, if you're not sure how much money you can save, or if you're not sure whether you're in the best plan, well, the way to avoid being part of the 90% that are in the wrong plan is to call them and see what they can do for you and how they can help you. They've helped thousands and thousands of seniors get into the right Medicare plan and save a ton of money. So thank you for watching this video today with me. I appreciate you spending the time with me. If you like what you heard, hit the like button, hit the subscribe button, and I'll see you in the next video.